Hello, I am Dr. Vimal Kishore. I am an emergency physician. I work for St. John's Medical College Hospital, Bangalore. Currently, I am working as the Director for Clinical Innovations at Koyo Labs. Today, I am going to give you a short demonstration regarding the working of the VAPCare. This is VAPCare's main control unit. These are the collection containers, and this is the bottle for lavage fluid. The first step is to power on the device. So once the device is powered on, the first screen that is shown is regarding whether it's a new or an old patient. If I press yes, so it's going to erase the data of the old patient that is pertaining to the suction as well as lavage. But for the demonstration purposes, I am pressing yes. When I press OK, the device is going to erase all the old patient's data. The next screen is this animation that is showing further steps of device operation. The first step is to connect the vacuum source to the device, which is connected at the rear end. The second step is to connect the filter tubings to the collection containers as per the color codings. Orange indicates oral, oropharyngeal is represented by green, and then subglottic is indicated by yellow. I am going to connect it as per the color codings given on the device. And these are connected to the respective collection containers. I am connecting the lavage tube at the rear end of the machine to the input port of the device. The next step is to connect the tubing kit to the respective collection containers as per the color coding, and connect the lavage tube to the lavage outlet of the device at the rear end. Then we're going to clamp the tubes and then press OK. So the device starts the leakage check. This leakage test will test the integrity of this entire system, starting from these tubings till the device, if there is any leakage in the connections. So once the system displays unclamp the tube, so we have to unclamp the tubes, and the system shows the next steps for the patient connections. This disposable is called as VAP lumen. This is inserted into the patient's oral cavity, and it is similar to an oropharyngeal airway. This part goes into the patient's oral cavity. This part acts as a bite blocker to prevent biting of endotracheal tube. This blade prevents the lumen from slipping into the patient's oral cavity. The foam protection is given to prevent any pressure injuries on the lips of the patients. This lumen has multiple channels and ports. These ports suction out secretions from the oropharyngeal region, these ports from the oral cavity. This metallic tip sprinkles antiseptic solution into the patient's oral cavity to perform lavage. All these ports are connected through these catheters, and these catheters again are color coded. The length of the oropharyngeal catheter can be adjusted according to the patient's anatomy. Now I will demonstrate VAP lumen insertion. Before doing any patient procedure, it is important to follow proper hand hygiene protocol, don gloves, explain the procedure to the patient legal representative, and obtain consent. Before performing the procedure, please make sure to keep the VAP lumen and the tongue depressor ready by the patient's bedside. Before insertion, ensure the patient's vital signs are stable. Check the endotracheal cuff pressure according to the hospital protocols. Keep the patient in the supine position and place the endotracheal tube in the midline. Note the marking on the endotracheal tube before procedure. Hold the endotracheal tube steadily along with the cuff inflation and subglottic port tubes with the non-dominant hand to avoid interference during insertion. Pull down the lower jaw. Check if the tongue is in the midline. If not, use the tongue depressor to bring the tongue back into the midline. Place the VAP lumen with your dominant hand above the endotracheal tube facing towards the upper lip. Endotracheal tube in the groove of the lumen. Gradually push the VAP lumen till it reaches the lip.
and secure the tubes with the velcro provided. Secure the VAP lumen around the patient's neck with the velcro. After lumen insertion, we have to connect the lumen to the tubing kit as per the color coding. So once it is connected, all these catheters need to be inserted into the sensing unit. This is the sensing unit that detects the presence or absence of the secretions. In order to have the optimal function of the sensing unit, it is necessary that all the catheters must be placed in a proper position. Once the connections are made, the system leads to the parameter setting screen. Here the physician can choose to set the pressure in different anatomical regions. Oral and oropharyngeal pressures can be set anywhere between 45 to 200 millimeters of mercury, and subglottic pressure can be set from 45 to 120 millimeters of mercury. The suction interval can be set from 15 minutes to 420 minutes, similarly lavage interval. The default values are 110 millimeters. The subglottic pressure, I am setting it to 45 millimeters of mercury. And suction interval, for demonstration purposes, I am keeping for 30 minutes and lavage interval as 50 minutes. Once you press OK, the screen prompts for confirmation of the parameter settings. So you can review the parameter settings and then press OK. It goes to the begin suction screen. Once we begin suction, the device starts setting pressure in the individual anatomical region. So as you can see, the set pressure is 110. The device is going to set the pressure to 110. So now it starts suctioning from that different area. If the device detects an absence of secretions in any specific anatomical region for 3 consecutive cycles, device throws a no secretion alert. This alert will stay on the screen for the period of 5 minutes till any health staff is going to attend and then press OK. Else, the device is going to resume its function after 5 minutes. I am pressing OK here. So the device will start resuming its function. So now it is doing its oral suction again. So you see that it will continue for 13 seconds if there are no presence of secretions. As you can see in the mannequin, there won't be any secretions. So after 13 seconds, you will see that it has changed to oropharyngeal suction. So now it is again setting pressure to 110. Now it started suctioning. Now as you can see, the secretions being sucked out from oropharyngeal region. This suction cycle will continue to the maximum of 1 minute till the secretions are present. If the secretions are absent, the suction cycle will go to the next cycle after 13 seconds. Now here you are seeing that there are secretions coming out from oropharyngeal region, so that's why the suction is going on. You can see in the subglottic suctioning, so the device is collecting fluid from the subglottic. So in this case, for the sake of demonstration, we have instilled additional fluid into the oropharyngeal and subglottic region. The suction cycles continue as oral, followed by oropharyngeal, then by subglottic. At the end of all the 3 cycles, the device goes into a idle state. On the screen, it mentions the next time of suctioning and the next lavage timing. The device has on-demand suction and lavage feature in addition to the routine cycles. In order to do that, there is a separate button, suction and lavage. When you press this, it will prompt for either you want a manual suction or a lavage. For the sake of demonstration of lavage, I am going for the manual lavage and pressing start. When you press start, the device sets the pressure to 225 maximum pressure, and then after spraying antiseptic liquid in the oral cavity of the patient. The device sucks simultaneously from all three different locations for the period of around 5 to 10 seconds, followed by a mandatory suction cycle. Now you can see the pressure is set to 222, and the lavage is being sprinkled, and then there is a lavage fluid stays in the patient's oral cavity for around 15 seconds. Then the device starts suctioning simultaneously from all three different locations. Now you can see the suction is sucking out from subglottic region presently. The device has port block detection and relieving feature. In case of port block detection, the device raises the pressure transiently to the port unblocking pressure of 225, which can be set anywhere from 45 to 285 millimeters of mercury. The device tries to attempt to relieve the port block for 3 consecutive attempts, and in case of failure, it throws an alert on the screen for manual intervention. To demonstrate the port block, we have simulated it, and this is the third port block going on. This is the alert. It's an oropharyngeal port is blocked. So this actually requires a manual intervention. When there is a alert for a manual intervention in the event of a port block, so to relieve the port block, it is advised to push in this oropharyngeal catheters by 1 centimeter and then retract back by 1 centimeter, and then press OK here. This will relieve the port block.
Thank you for your time and attention. I hope this video was informative.